All right. Good morning. Sorry, it's kind of like one of those disjointed kind of mornings. Really, we have. As I mentioned, there's a lot going on behind the scenes, getting the station ready for a Jeep parade for Lehigh Valley Health Network down in the valley, and we are going to have this Jeep parade come north, if you will, to the Lehigh Valley locations right here in Carbon County as well. And the Jeep enthusiasts of Eastern PA have that all worked out. But listen, in the meantime, as I mentioned, we have our state representative Doyle Heffley on board here with us. Doyle, good morning. How are you?
We're doing okay. How are you doing this morning, Doc?
Day by day, positive vibes, working together. But boy, things seem to be changing by the hour, by the minute. What can you update us on? What's going on?
Well, I mean, look, things are changing by the hour. They are changing by the minute. These are unprecedented times, and as a nation, as a community, we're coming together. We're working on a couple of different things. We've had a couple of announcements this week from the Wolf administration. I mean, we were in session earlier this week, voted on some legislation, and trying to get some businesses to start to reopen, whether it be the car dealerships and construction that where one or two people can work alone, trying to get some of those things going again. But I guess the biggest thing that we're hearing about right now is still the unemployment. We did hear from some people. Some of those checks are starting to roll out. We did have a long conference call the other day with the Department of Labor and Industry, and really talking with them about the need to get these programs up and running a little bit quicker. We're hopeful that the small business owners program will be rolled out early next week for the application process, and start to drive some of those dollars back out, those folks that are unemployed or can't work right now due to the pandemic. So that's a big thing we've been working on here in our office.
Right. That is one of them, because, and you're full aware of social media, people got on it right away. People got on the applications right away, and then they ran out of money. I think I remember one interview that I saw on TV saying that we're going to need more money than this, and that's coming from the feds way up top, and nobody listened. They said, no, and that's so. I'm just saying that on my own behalf. Anyway, maybe it should have been more money right in the beginning. However, with that said, though, obviously it's coming down from the top down, and into PA. Like, again, elaborate on that. Is there more money being, created? Where is it coming from? What's going on for these people that are truly well-deserving, Doyle? You and I talk sometimes all the time about bucking the system. There's plenty of them out there that'll never, ever stop. It never has. It's been around since the dawn of time. However, there's great people out there that are needing some help. What's going on there?
Well, first off, to reassure everybody, like unemployment compensation, folks are going to get that money, right? Mm-hmm. That is coming through. That money is in there. The extra $600 that the federal government is going to put on top of that, that's coming through as well. If they receive a check and it's not all in there, they are saying that it's going to be, they'll receive it in the checks going forward. It's just a matter of we went from 40,000 weekly unemployment claims to 1.4 million.
Sure.
So that is, those numbers are staggering. And at the end of this, we'll talk about all the concerns we had and frustrations we had. But right now, the department has hired more additional staff. They moved people from other state departments that were shut down. I mean, the state furloughed a lot of employees, and they brought some of them back to work in different areas to help out with this unemployment. And they are putting on extra shifts or working through the weekends. Mm-hmm. So they're trying to get that done. We do have the uc.pa.gov, which we talked about last week, mm-hmm. a website to help people, and people are calling our office, and we're trying to, we have contacts through the department, but they're overwhelmed as well. Yeah. So it takes us much longer to get through to them, but we're trying to do all we can. But the money is there for the unemployment. Now, the small business, there was a small business loan program that the state ran, and that did run out of money. They are looking at putting additional resources into that. The federal government, the PPP loans, and that's where employers can take a loan out, 0% interest, and it can be They won't have to be paid back as long as they use that money to pay their employees, and I think there's other stipulations, utility bills, and those are federal loans. Now that they are saying that right now, that's in the news, they are working to get more money approved by Congress into that program. I think there's going to be a lot of help and assistance out there. The problem is just the numbers of people that are looking for this assistance and the time it's taken to get that that money out to the folks. That's the frustrating part on our end.
Yeah, no, and again, listen, this is right or left or middle, wherever you are in the whole political arena. I'm done. I'm done with it. I'm done with all of it. We need, as we mentioned every time, we need to work together. No one has all the right answers for things that are going on here. You can blame that we didn't act fast enough. We didn't do this. We knew this was going on. There's more to it. Here's a conspiracy theory. Here is this. Here is that. Here. What does that even mean? At the end of the day, what does that even mean? It means absolutely nothing, and it's what we're alluding to. We need to have patience, what we said before, and work through this together. No matter where it is, how it came about, doesn't matter. We need now to figure it out and work together and help each other. Is what we need to do.
I think that there's as things develop, as we move forward, first off, we dealt with the shortage of toilet paper. Then we had the run on the grocery stores, and people were hoarding things. And then we had the discussion about the masks. And we've gotten a lot of calls yesterday. Now, look, I I have a lot of concerns, and with the governor's office, how they administer things, how they run things, and we don't always see politically eye to eye.
Correct.
The governor put a directive out to wear masks. Now I think he needs to clarify that, because if you're a welder, you can't really wear a cloth mask. So I think there's some clarity that needs to be given out to that.
Right.
However, I think here's the thing. People call and say, "Well, you're infringing on my rights. I shouldn't have to wear a mask to go into a grocery store or this and that." Look, I mean, this is a brand new illness, and actually later today, and on Facebook, and I'll put my own plug in here.
Yeah, go ahead.
I'm
please.
actually going to be interviewing Dr. Markson from St. Luke's Health Network. We're going to be doing a go-to-meeting interview. We're going to then put that out on Facebook. Hopefully that'll be up later on this afternoon. I think we're going to do the interview at 1 o'clock. It won't be live, but we're going to then put it up on YouTube after we record it.
Great.
And we're going to try to ask them a lot of questions. I talked to them a little bit yesterday, and the thing is, this is so new, and they're still learning and finding out what the best treatments are. Why do some people get it? Why don't others get it? They're trying to do the antibody test. They're trying to do the rapid test. There's so many things that they're putting into it right now. I would say just how the communities have come together, how the nation has come together. I know looking at the president's plan, how do we get the economy back up and running? Because it is so important that the business of America is business. We have to get the economy in a safe manner back up and going. So if you look at the face mask thing, right? So we're now finding, and I've read studies that some people say yes or no, that this disease could possibly is being spread through the air. So if you're talking to somebody who's asymptomatic and you're within a proximity to them, and there's not proper ventilation in the room, that those micro droplets can hang in that room for hours, right? And somebody can walk in there and possibly get infected. It's not known yet, but the science is unsure, and it's a new disease. So they say, look, we think that if everybody wears a mask, because that will prevent as many droplets from going out when somebody's speaking or when they're breathing. So if you go to the grocery store, if you go to work, wear a mask. I mean, this isn't about infringing on anybody's rights. This is about a public health pandemic, and I do. I mean, there's plenty of things that I disagree with the governor. However, I think let's just be responsible to each other. Like I said before, personal. With all our liberties and freedoms comes personal responsibility.
That's right.
And if you can protect somebody by wearing a mask, then do it.
Right.
I mean, if it makes that person feel more comfortable, then do it, and let and also the employees in the stores, let them wear a mask. Look, nobody wants to wear a mask. I mean, people think I look better with a mask on, but look, nobody wants to wear a mask, and nobody wants to tell people to wear a mask. However, with what we know now, it's deemed that we could slow the spread or prevent people from getting ill by wearing a mask. So hey, let's all do this. Let's come together. let's do it for our community, do it for our neighbors, do it for our country, because that's what we're doing right now.
What do you say? What do you say? And I agree. Personal responsibility. Where do we stand with this? And this is a question that came in. It's not a detailed question. It's very hard I'm sure to answer. Is there a timeline? I mean, we're hearing timelines all over the place, and I understand that it just can't, like, by noontime today, everything's going to be open in the country. That's not going to happen, obviously. And when it does, it's even going to take some time, as we mentioned too, to get back to some kind of routine. But is there anything being talked about that people, because that's what people are asking, and I'm sure you hear it all the time. Where are we at on a time frame? I'm not so sure there is an answer, but what can you give us from your perspective?
Well, it can't happen soon enough as far as I'm concerned.
Right.
However, but we have to make sure that the science is that we're looking at everything. Now, Germany, they just announced yesterday they're going to have partially reopened their economy. They're expanding the testing. I think there's a couple of things that we need, and this is, I like everybody else, I'm watching the national news, but I'm also reading a lot of things that come through our office. I'm talking to the healthcare providers in the local community here, and how many cases we've had. How this thing is really being spread. So part of it is to further recognize how it's being spread. And that's one thing, like wearing a mask. So if we can determine that by wearing a mask, people can move about a little bit more freely, we don't have the community spread, then that's going to get us out there a little bit sooner. However, you might have to wear a mask.
Right.
I think the hand washing and other things. One of the things is these thermal temperature readers. When people go back to work in larger facilities where there's a lot of people working together, do they need to take their temperature? I think one of the keys is the rapid testing, and even like at-home testing. Now they're developing these right now, but it's going to take time once they get it developed to mass produce them to millions of people that are going to be testing every day. The thing with the testing is you can get tested today and then be exposed in the afternoon and be asymptomatic for the next 2 weeks. So,
right.
So it's how do we go about that? How do we take certain vital industries and protect those employees, like the meat packing, and there's been talk about the meat processing facilities and contaminations and temporary closures and shutdowns. So that's one of the keys. We're going to keep those facilities up and running. How do we go about to make sure we're protecting that workforce? The power plant, the folks that work in the power industry, those folks those vital industries that have to be working all the time. How do we go about protecting that workforce? That's going to really determine how soon we can get back. I mean, I would love to open it up tomorrow. I mean, I serve on the Appropriations Committee in the State House, and we desperately are going to need to get the economy up and running. The state doesn't have money if the businesses aren't operating, right?
Sure.
That tax revenue comes in, the state then appropriates that revenue. So I'm very anxious to get that back, but when we do, it's still going to be a level of responsibility. How are we going to get people to feel comfortable going into a restaurant and eating again,
right,
or going out to event? Do I think there's going to be a time in the next couple of months where we're going to have baseball, people going down to watch baseball games? I don't know. Concerts, those types of things. I don't know how that happens without either a vaccine or a really, some type of really a treatment. But
right,
those are things that I think the best thing that we can all do to get that timeline ahead and get back to work is to take all the precautions that we can to mitigate that risk, to not get sick, as we work through, finding if people have antibodies, how much of the population has already been exposed, how much immunity is out there as they continue to develop the vaccine. So that's kind of a tough question to answer, because I can tell you that everybody in government that I know, they want to get back as soon as possible.
Yeah.
But how do we do it in a safe manner?
It's just it's crazy. What do you I don't know if this is discussed with you guys, how you can elaborate on it. Things are being talked about from other doctors, not from our area, outside the area, outside our country, but they said, listen, by doing what And everybody second guesses. Everybody does. Listen, I'm throwing it out there as just a common guy here, man. And on behalf of a lot of other people that are hanging out here with us and that I run into and we talk about. And that is, slowing the spread in what we're doing and social distancing. From what I know you're not a doctor, but from what you people have talked about, which I'm sure it's quite deep and long, but the idea of slowing down the spread, but we're not building up antibodies in our systems, and this might be a question for a doctor, but we need to build up antibodies even on our own with us, inside for this virus as well. Am I making any sense? Like, in other words, like the social distancing seems
the herd immunity concept.
Yes, sir.
Well, I mean, yeah, I'm not a scientist either, and actually I'm going to ask Dr. Markson this afternoon a little bit of these questions. But
sure.
From my understanding, this is the issue. So you look at, like every year the flu comes around. I get my flu shot. I mean, I know there's a lot of people that are anti-vaxxers and everything else, and God bless them, that's their decision. For me, if there's a vaccine out there, I don't have to get sick. I'm taking it. I had pneumonia last year from my allergies flared up. I wound up with a case of pneumonia. I hate getting sick. If there's a vaccine, I do think that there's something to it. So I'm taking it. Mm-hmm. I think developing a vaccine is critical. So here's the thing: if you look at this, it's so unknown. This disease is so unknown, right? So I mean, there's cases now, people that are dying from heart issues where this virus is attacking the heart, attacking the kidneys. One of the things that we're seeing now is a lot of people, like from what I heard, 50% of the folks that get put on a ventilator don't survive this disease. And a lot of it is not just because of the ventilator, but it gets in the blood, it gets in the kidneys, and so there's so much that's unknown about this, which is why I think look at what happened in Italy. Right, they overwhelmed their hospitals. Now, we have not done that in this state, in this nation. Now, New York City is probably the closest example, but there's people in New York that are in their 30s, 40s, 50s, 20s, 60s that are relatively healthy people that have died from this disease. Mm-hmm. So, nobody has immunity to it now. When it does spread, it spreads so fast because of that. But also, we're not exactly sure how it all spreads yet, as well. I mean, from what I know, and reading and researching it. So I think the mitigation efforts are definitely saving lives, okay. Right? We're not overwhelming our hospitals. Mm-hmm. I think they reported yesterday that 25% of the people that tested positive were actually healthcare employees. So that's which is very concerning. Mm-hmm. And I think, I hear from a lot of people that say, well, it's all fake, it's not real. It's like, well, if that's your belief, then go volunteer at the hospital because they could use you if you're immune to it. Yeah, I agree. I do think that we all need to do our part. I do believe that, and I don't agree with with everything the governor's doing, because I think we need to start rolling back into our economy to a degree of what businesses I think can operate and can operate safely. But then it's going to come back to those individuals to do it safely, to follow the best known mitigation practices that we have at this time. And right now we're rolling those out, and that could change as we learn more about this disease. And I think that's, people say, well, you said this 3 weeks ago, and now somebody's saying this now. Well, we know more now than we did 3 weeks ago, right?
Right. No, I'll tell you. I'm sure this isn't easy. I mean, by all means, and I think you answered that question very well. Not being a doctor, not being a scientist, but that is what that was my rebuttal when I talked to even friends, and we just talk, because if you have a very, very, very small percentage, I get the herd, the herd aspect of it. By listen, get together, get out there, you'll build up an immunity. You will. I'm sure you will. However, you have a small, very small, minute percentage, just in this country alone, that would get sick. I mean, the roof would blow off.
So we have 113 cases here in Carbon County, mm-hmm. and we have now up to 6 deaths. Mm-hmm. That's what, about 4.5% or 5% fatality rate with those that have been diagnosed. Now, I can tell you that like we talked before, there are pockets of areas where we're seeing higher rates because it's spread through the community.
Right.
Now we have in Carbon County, and the surrounding counties, even in Monroe, through what we're doing right now, we have slowed the spread down. So look at it this way. And I guess it's just my like the stomach bug, right?
Mm-hmm.
Usually, if one person comes home in your household with a stomach bug, it sweeps through that whole household, right?
Good point.
And it's highly contagious. The stomach bug, you get it for 2 days, it's awful, and you get over it, right? So now, if we look at the coronavirus, now this thing here, there's people on ventilators for up to 17 days, 10 days, and most of the people, by the time they get admitted into the hospital, this isn't a 2 or 3 day stay. These folks are in the hospital, in many cases, for 2, 3, 4 weeks,
mm-hmm.
and sometimes on a ventilator for 3 weeks. So that's if we can say, like, if that one person, when that one person comes home with a stomach bug to your house, if you isolate them right away, the rest of that person gets better, and the stomach bug doesn't go through your household, right?
Mm-hmm. Yeah.
Doesn't mean that they're immune to it. Just means that they weren't exposed to it.
Right.
I think that's what the mitigation effort is now, until we develop those vaccines or a better treatment. I mean, and that's some of the questions that I'm going to talk about when I interview with Dr. Markson a little bit later today. It's to get a better understanding myself. I mean, I'm reading, like, there's so much stuff on Facebook. I mean, somebody, like, people try to post stuff on my personal Facebook. Nobody else posts on my personal Facebook but me. People have their own websites, their Facebook, they can post on it. But, people post, there's some doctors saying that it's all a scam, it's not real. It's like, I don't know there's so much stuff out there on social media, they're advertising this cures it, that cures it. I don't know. I don't see this big conspiracy. Now, I think, look, government ideology is going to take over party ideology, and they're going to try to capitalize on anything. Mm-hmm. But I don't see, the state government can't even get unemployment up and running. There's not going to be a mass conspiracy to control the coronavirus. They can't even get unemployment checks out, and we've been doing that for the last 100 years. Okay, so the government doesn't operate like that. Not that I see it. Now, do people have agendas? Yeah, and we combat that every day. That's why I stand up for the people that I represent, and I reflect their views and go to battle with anybody over that. But I don't think this is a vast conspiracy at any level. The government is just not that organized to do it, quite honestly.
Yeah. Addressed very well. There's so many questions that we could keep going. Somebody just said, too, again, about the money, with them running out of money, what's going on. We addressed that earlier on the interview, so you can go back. All the interviews that I have with Doyle are on and uploaded to the Colossal Radio YouTube channel, and this one will be later on today, early evening, but the others that we have discussed over the last couple of weeks, you'll find on the Colossal Radio YouTube channel. Go back, you can listen to them, as this one will be up again later on this afternoon, early evening. So much. I'm on a timeline here today. I know you are as well. Every Friday, normally, though, around 11 o'clock, and Doyle Heffley, our state representative here in Pennsylvania, first one to reach out to us by saying, would you consider doing like an update or what I could give to our area and what I know for just our area? And that happened weeks ago, and obviously the answer was yes. Every Friday, usually at 11 a.m., but I'm happy that the radio station, when we talk about our hospital workers, that the Jeep Enthusiasts of Eastern Pennsylvania has organized a Jeep parade for LVHN down in the Lehigh Valley today. So is going to be pretty neat, and we are going to make our way. They are going to make their way. I'll be with them coming up here into Carbon County and the Lehigh Valley Health Network locations here as well. So, but today is down in the Lehigh Valley, so we're pretty excited. That's great.
Are they going to take those Jeeps and go mudding first? Because I think it would be an awesome parade to have a bunch of mudded up Jeeps coming down the road.
That would be fun. That really would be fun. But I wash mine. I don't know if I should even have washed my Jeep. I don't know. Now I'll be the only one down there with like a really nice shiny Jeep, and I'll be going, boy, I look like an idiot. Mine's
you got to mud it up on the way down there.
All right, I'll try to. I'll see what I can do. I'm sure Blake would like that as well. So my youngest son Blake and I are going. We're going to be part of this Jeep parade. We'll go to the Colossal Radio Facebook page on it, so y'all can see what's going on firsthand right here locally as well. And there's been other local parades, but So, I guess to bring it full circle, there's so much more I want to touch base on, and we can do that again next Friday just after 11 o'clock. Normally, again, it's 11. In this case, getting out a little early due to this event. But food supply, stuff going on there. What else? Give me another 2-3 minutes to bring it all full circle here. Anything else we need to know or we can do here?
Okay, well, first off, let me just say that anybody who wants to get updates, we try to put as much information out as timely as it comes out on our Facebook site or our website, repheffley.com, and click on the coronavirus link, and it's going to give all updates on unemployment, on different programs. Also, we work with Dan Muser, Congressman Muser's office, because a lot of these programs are federal, and they're being rolled out at the federal level, and we're trying to get information out. So that's one thing. For information, please check the websites and our Facebook link. Our office is open, 610-377-6363. Leave a message, a detailed message. My staff is working remotely. They will pull the messages off. They will call you back. Please, if you have your phone blocked, though, or my staff is working remotely, they're using their personal cell phones, so their caller numbers are blocked. So, and also when they get calls back from unemployment, they're going to come back with a blocked caller ID. So a lot of people have settings on their phones, and that's why they're missing calls. So take those settings off if you want to get a call back. Mm-hmm. The second thing I want to touch on is nonprofits, right? Our fire departments. And now my wife and I, every Sunday after church or before church, we try to go to a different fire hall breakfast and support our fire companies. And they do fundraisers all the time, ham dinners, whatever. The fire departments, your local nonprofits, your churches, they are doing a lot, and they still have the same costs, and they're still doing a lot of outreach and providing stuff to people in need. If you can afford it, if you can, continue to donate to those organizations, because that's very important that those nonprofits continue to operate and provide those services. So if you can afford it, then definitely go ahead and donate to them. We are working on some things with the food supply chain, and one of the issues is so much of our food in this country is packaged to sell in bulk to like restaurants. 50% of the food in this country is packaged to sell to restaurants, right? Everybody eats out, and now everybody's going to the grocery store shopping. So they're transitioning their food line. Food, instead of packaging in a big can of green beans for restaurant sale, they're packaging into smaller cans, right? Uh-huh. Eggs, for example, when restaurants get eggs, they generally get them in a box of 50 eggs. But now we're working to get through the packaging process, and how do we sell to grocery stores versus buying in bulk. Like a restaurant, they may get a slab of meat that's not cut up. Well, when you go to most people don't shop like that. So that's one of the transitions that we're going through in our food processing facilities, and then we're also working to ensure that the employees in those facilities are safe and continue to work, and we continue that supply chain, because right now everybody's getting their checks. If everybody goes out and hoards food again, there's going to be it's not that there's the lack of food, right? Because it's still coming out. It's just that how they package it is going to be a little bit different. So that's one of the things that we're working with. Pennsylvania is an agricultural state. Ag and tourism are 1 and 2 industries statewide, and we have some. We're working to try to iron some of those things out so we can have no disruption to the food supply chain. I can tell you that a lot of restaurants right now are doing bulk sales. Mm-hmm. They can, restaurants can sell. So you can, if you have a restaurant in mind, you call them up and say, hey, can I buy a box of raw chicken? And you could probably buy a 40-pound box of raw chicken because it's there. They can get it. So
the Hufford Mill is doing very well. They're working their butts off with that every week, and their website is updated, I got to say, locally right here in the area with them, doing bulk sales. That is an enormous task to do what they're doing, and then organizing everything and packaging it up. Masks, no contact curbside pickup. You open up your trunk, they bring it out, they put it in your trunk, and away you go. I mean, they developed a pretty good program for people, and right now it's been doing very well for them, but an enormous amount of work they're doing. But I'm glad you brought that up.
Yeah, and that's one of the reasons why we went out to Harrisburg this week and we voted on Senate Bill 613, which would have allowed some different sectors of the industry to open up, but they must follow strict CDC guidelines, right?
Sure.
But if given the opportunity, the private sector, the entrepreneurs will find a way. they're going to find a way to get. There's a market. They're going to find a way to fill that market.
Agreed.
And that's what we need. Like, look at masks. I mean, nobody had masks before. Now everybody's sewing masks, and businesses are sewing masks, and businesses are making, N95 masks, and other businesses are making testing kits, and that's what's great about this country when you let, when the American ingenuity comes through, and I mean, and we will get through it together. And hats off to them. I know the Restaurant Lodging Association statewide, the federal government made some regulatory changes, as did the Department of Agriculture here at the state, to allow to make it easier for restaurants to do these types of bulk sales. So that's just one thing. Hey, you're looking at it. It's like, how do we? This is the need. How do we fill it? And we're going to make these changes. And then the private sector is going to step up and fill that void.
There's a lot. There's a lot to discuss. I'm sure there'll be a lot that transpires over the next week till we talk to you again. And we'll do it a little after 11 o'clock next Friday. Our PA State Representative Doyle Heffley on board here with us for the last little bit. One more time with that shameless plug on the YouTube with Dr. Markson, who I know very well, great guy. One more time with that. If people want to pick this up, it's not going to be live, but they'll be able to get it where and when today.
It will be posted on my Facebook site later today. We're going to do the interview at 1 o'clock, and then until because I've never done a Facebook Live event, so I'm not about to try that. I'll mess it up. But we're going to try it probably a little bit later on. But right now, so we're going to record that video, and then we'll have it up. I would suspect hopefully by like 4 o'clock, 3 or 4 o'clock today, we'll have that on Facebook, and it's going to be there. It'll be on like any of our videos that are on Facebook, or they're just there forever. So
yeah, all right. Then you can look for that in the interview with Doyle and Dr. Markson as well. So listen, I'm glad we were able to spend a little bit of time, talking about a little bit of everything. A few questions that came in on our limited time here today. But by all means, next week we'll take your questions. In the meantime, I don't know, like we say all the time, patience, is where we are right now. Patience, because it's not easy and definitely uncharted waters.
Yes, it is. We'll get through it together.
That we will. State Representative Doyle Heffley taking some time to hang out here with us, and I thank you for that. Doyle, hang on. We'll say our goodbyes here in just a couple of seconds. And for the rest of you that are on board, I got to do a quick break. Listen, back into the set list. We're going to be going to Facebook Live with the Colossal Radio Facebook page, part of this Jeep event that's we're doing with them and for the Lehigh Valley Health Network. So sit tight, stick around. We'll be back.